I have a Russian descent. I graduated from medical school in Russia. So I have medical and dental school. And the education I got was very broad education. We actually study medicine. It was small part of dentistry, but most of it was medicine. And, internal medicine, cardiology, on that level. That's what we study. And then I moved to United States and I graduated from NYU Dental School and I did general practice residency. We also focus on the medically compromised patients. But then, you know how great things can happen from negative emotions sometimes? I was really, first of all, I didn't know what would be my pathway, but I knew for sure I really like aesthetic and I really didn't want to fail. I didn't want to have a lot of emergency in my practice. And, I started digging further. I took a lot of courses on cosmetic dentistry, but then I was so scared. I thought, I'm going to do those beautiful crowns and they're going to break. What should I do? If I'm going to protect them with a night guard, what they're going to do during the day? My, waiting room going to be full of emergency. How I'm going to face that? I'm going to be so ashamed. So I thought, okay, I can, do the cosmetic, but if I position teeth in the correct way, if my ortho gonna be done right, then with the correct occlusion, everything gonna work all right. But then I learned if I do the ortho, I did like 2 years of ortho. I noticed what after ortho things relapse as well. And I was puzzled. So they grind the teeth, they move the teeth after ortho. And then somehow I was really lucky. I realized probably the answer is in the sleep. If they have those tremendous forces at night, they can break anything and everything and change the position of the teeth. They can do miracles. And then I start doing sleep. I started doing it around 15 years ago. I did like a mini residency in Tufts. And then that's the journey begin. And it's also, like in sleep, what I learned, and it took me many years to learn, what as a dentist, we look from a neck up, and as medical doctors look from neck down. We're so disconnected. And whatever I'm trying to explain to them, what I can do, such a great things for their patients, they listen to me and they see what they see. It's really hard to find collaboration if we have totally different philosophies. We have to kind of meet at certain point. Yes, it took me several years with that journey to convince people around me what I can do. That's a separate story how, you build the sleep apnea practice or, dental sleep medicine practice. But then with that, I do have dental sleep medicine practice, but I practice it in a little bit different flavor. Besides oral appliance, I also offer them myofunctional therapy because I realize if they, tongue is very low and it fall in the airway and they breathe through the mouth, and it can be a very different journey with oral appliance and not always successful. So that's how I incorporate that. Also, in the same time, I do ortho and I do prosthetic in addition to oral appliance or during the same time as I do my oral appliance therapy. But still, I still work with the medical doctors and I still see that disconnect. And I start my community on the Facebook and the YouTube, where I try to educate my patients or maybe some medical practitioners who I work with about my philosophy, or most likely I also learn from them and try to see the situation through their eyes.
So you come over from Russia. You're already trained as a dentist and a doctor and then retrained here in the United States?
Yep.
Okay. And it sounds to me like you start to see things that you can't unsee with your patients, and that dentition is breaking and you can't find the cause during the day. You find the cause during the night. Transition your practice over from a traditional dental practice to a dental sleep medicine practice. And now the challenge becomes, how do we get the traditional medical community to open their minds up to collaborating with you to help improve patient outcomes? Is that a fair summary of what you just said?
That's totally perfect. Or at least, I would say, at least to see us as equal practitioners.
Now, I would think that because you are a medical doctor, that road would be a lot easier for you.
No, actually, I'm not a medical doctor, but in Russia, the education little bit different. The dental school, it's not a separate entity. It's part of, it's like a department in a medical school.
I see. Okay.
I did not become a doctor. I'm not a MD. I was a dentist. I graduated from dental department.
I misunderstood.
But just how training happened, it's actually working to my benefits because I got, kind of cause and effect. I understand, on systemic level, a lot of things I understand on systemic level, and it really helped with the sleep apnea patients.
So you practice in New York City?
I practice in New York and New Jersey.
Okay. And who's your typical patient?
My typical patient, my typical patient would be somebody who was referred to me by medical doctors. But in addition to sleep apnea, some of them have, I would say, prosthetic pathology. They have broken teeth, effect of bruxism. And a lot of them who have they have malocclusion. And I tried not to lock all of it in the oral appliance. I explained to them, but yes, we can correct. We can correct that in the same time as you have your oral appliance therapy. I use certain appliances that give me that opportunity to change the occlusion and to restore the occlusion, and then, have a final oral appliance afterwards.
Let me ask you this question. How are patients suffering because the medical community is resistant to collaborating with the dental community when it comes to sleep disordered breathing and sleep issues in general?
They suffer a lot. It's really frustrating journey. I wish what it would be someone, let's say, who would spend time and educate the patients about all the options, and they have something that they can choose for them. We're not, we are different. I look that way, you look that way, you have that taste, I have that taste. We have, different food preferences. How come when it comes to treatment, everything, all the same? You start with your CPAP. They don't ask if you breathe through the nose or you breathe through the mouth, and they offer that mask, that. Okay, and they don't educate people about oral appliances. They don't educate about Inspire. Myofunctional therapy, that would be somewhere in the air. It would be never mentioned. A lot of people come to me, I'm in the oral appliance world. It seems to me, I'm surrounded by people who live and breathe, sleep medicine. And it seems to me what everybody should know about oral appliance therapy, but people come to me, they have no clue. No one mentioned to them. They try to do their own research. That was the reason I create my channel, and I hope I have, a little bit longer interview in the short educational videos. What education should not be boring, and if people have a very short attention span of 15 to 30 seconds, I can at least give them that much wisdom, at least to open their eyes in that amount of time that they can listen to me. And, that's, your question, yes, they suffer a lot because they're not educated.
What's the most tragic case you've had in that regard, where there's been a miscommunication or resistance from the medical community, where a patient could have gone down a road of thriving but went in the other direction instead? Can you think of one?
It's very hard for me to bring you like specific phase. I need to think about the patient, but I would say, let's say I would take all my patients and put them in, into together,
right.
And it would be somebody who, who suffer from falling asleep behind the wheel, headache in the morning, tiredness, and it not necessarily would be overweight, obese person or older person. It would be young professional, like picture that, male or female. It can be, both way. And then this person, partner would say, you snore, I can't sleep with you in the same bed. I'm going to move to different bedroom. That's already tragic. That's tragic for relationships. So let's say that. And then this person under that pressure, he wants to keep sexual life normal. He wants to keep the relationship going to the sleep doctor. And here we are. Now your life is with the CPAP. Your life is with the CPAP. okay, person, have understand the risk. He has to go that pathway, and he start working with the CPAP, also mask, fitting of the mask. It's also, not the story. He might have a, chronic sinus infection, and they would still put him on a nasal pillow. So that's not going to work either. And, he's trying and trying and trying, and totally lose all encouragement towards that, that pathway of treatment, I would put it this way. And then it's already tragic enough. It's tragic. It's really tragic. But they lose so much time going through the treatment modality, what's not going to work. And then, if they, persistent and they ask the doctor for other choices, they might get to oral appliance therapy path. They might or might not, or they might just live that way and never find help. But the cases, yes, I get cases, I get stories of people who would tell me exactly the same story over and over. They have a bouquet of disease. They have acid reflux, they have a sinus infection, different type of allergies and asthma, the high blood pressure, atrial fibrillation over the years of no treatment. And then, if I'm lucky enough and I can convince them to go through oral appliance therapy, we might have a success. And I always offer them additional adjunct therapies. I don't focus just, okay, this is your oral appliance, now we're going to do that way. I offer them the choices. Okay, we can do oral appliance therapy. In addition to that, let's see what we can do with your nose. Let's see how we can teach you how to breathe through the nose. Let's see what we can do with your lips. Maybe if you can keep your lips closed during the day and hopefully breathe through the nose during the day, then maybe you can succeed during the night. So I try to offer them additional things, what they can do in addition to oral appliance.
How does it feel inside to be catching these cases when they're so far advanced? It sounds to me like that must be very discouraging, to be picking up patients after they've left the bedroom, after the diseases have started to kick in, where you can really only draw a line in the sand and hopefully gain back some ground, but have to have very realistic expectations about how much better you can get them. What does that do to you on kind of a spiritual level? How do you stay optimistic?
No, that's sad, but it has to be some light in the end of the tunnel. I always try to bring the light. I cannot focus on the bad things. That would be too sad. I'm trying to focus on the good things. So now we start our story. Let's start from this morning. Like, yes, we can talk about the years, how you live without oxygen. And some of them, I have that theory about cancer development and Alzheimer development, so I understand all of that, but I don't focus on the negative things. I try to focus on the positive things, what we can help from that moment. But of course, I wish the system would be a little bit different and patients would have all the choices and they can choose the path they want. Maybe through the, I always dream maybe sleep technician world can help us that way. Maybe medical doctors can look at us a little bit different. Maybe maybe nurse practitioners can spend time with the patient and explain about different streets and avenues, what they can take. And I, from another, I create my channel or community. I try to look through medical doctor perception. And I hear about that one dentist who doesn't want to understand patient insurance situation. I understand all of that. But there are a lot of dentists who want to help patients, who sincerely want to do something good for the patient and educate them and refer them to the right, to right practitioners and work in collaboration with other medical specialists. So I really wish the system would be a little bit different, but I think what you do, how you put the light on that problem, really help to change the world, to make the world a better place. And what I do in the same time as well as Airway Foundation. I think all of us, only together, if we collaborate and we make our voice stronger, we can change that. We cannot just focus on the negative things. We have to change it to the, to make it a better place.
What keeps you going day to day? It sounds like you're a natural optimist, but what you also have, you have to have a vision. All of us who keep going against, deep odds, and I think most of us in the airway movement are fighting the tide, for lack of a better way to put it, at least at this point in the growth of airway awareness and airway focused treatments. What kind of a vision do you have that keeps you going as strong as you go day in and day out?
No, number one, I see what I make a difference in a patient's life. I see those smiles, I see those happy eyes, I see people reunite in the bedroom. I think I have a mission to reunite people in the bedroom. I think it's sound rewarding enough to me. Yes, we're going against the stream, but I think all the pioneers, they always, that was a normal way. They try, they push, they fight, and they succeed. And, being a doctor, we get rewarded with appreciations from our patients. And like in your case, I'm sure, you understand, you helping us to keep going. Like you helping us, you kind of hold the light for us to keep going. I would put it this way.
I hope so. That's the mission that we have at Mad Rose, is to bring a place, have a place where we can help you take those next steps, for sure. And that to me is more important than financial gain or, power or prestige or whatever the case may be. It's one practitioner at a time being able to make an impact, because what I know is that if that patient doesn't make his or her way into your office, he or she could find himself or herself in the office of a medical doctor or a general dentist who's very well intentioned, but doesn't have the vision or the knowledge to point them toward an airway focused solution. And that suffering can go on for years as a result of that. Even my generation, I'm 56 years old. I had bicuspids extracted on the top and the bottom when I was 12. So that's 44 years ago at this point. And I'm on a CPAP machine. I had my extraction spaces reopened when I was in my mid 40s. That bought me about 10 years. But it is still progressing, and I eat well and I keep myself in shape. But there's only so much you can do against anatomy, where it just is not. I can slow down the progression, but at the end of the day, I'm not going to reverse it without a pretty invasive surgical intervention or orthodontic intervention. And that's I struggle with that sometimes. I wish things were different, but that is the way it is. What are your thoughts on? What are your thoughts on traditional orthodontics, retractive orthodontic techniques, and where the orthodontic profession is, and how it's affecting jaw joints and airway health?
I'm going to sound really cynical, but it's a joke, but it's true. What people who practice, people who have ortho treatment like yours, the practitioners, and I read a lot of articles, and I'm really deeply into ortho. I love ortho. I have orthodontists in my practice since 2002, and I do orthodontics as well. And I get my bread on the table because of that orthodontics. Unfortunately, I have to say, people who had that type of orthodontic treatment, they do have either sleep apnea or upper respiratory resistance syndrome. And people can prove me wrong, but I didn't meet anyone who didn't have any type of symptoms after that particular procedure. If they might have temporomandibular joint disorder, or upper airway resistance syndrome or sleep apnea. And yes, on my channel, I interview a lot of orthodontists who practice different approach. They're into expansion. I do believe in expansion. I think it's a great thing. I always try to expand as much as I can with, clear aligner therapy, or I use some other technique. And I believe in, that MARP and all of that therapy. I think it's a great idea. I see a lot of people with a very narrow palate and a very, they cannot even fit the tongue. I think it's that system. Unfortunately, I find a lot of resistance in orthodontic community. I have a very close connection with orthodontic community, but it's like very slowly, drop by drop. I'm sure they're going to get the message as well. And I'm trying to get into dental schools and give my message inside the dental school. That's a really slow system. But that's, I don't see any other way how it can happen. Also, I highly believe in the power of social media, things like you do with the podcast, things what I do with my channel, what dental students or newly graduate people, they're gonna search on the social media and see the interviews and see the podcast, and they understand what, yes, that's probably a different way. Probably we're gonna go in a different round. We're not gonna go through the headgear backwards. We're gonna bring everything forward, and face is gonna look better, and face is gonna be more beautiful. That's what they're gonna look good, and they're gonna function right, and the muscles gonna be toned, and hopefully that disease of our century, sleep apnea, silent killer, gonna change the face.
Why do you think the orthodontic community is so resistant? It would seem to me that they're the best of the best coming out of dental school. They get the best grades. They're technically the most skilled. If you believe what the dental schools are telling us, they only promote, the top 1% into ortho school. And to my eye, and I'm not a doctor, looking at the simple evidence, just what the scores are on the sleep tests, what the imagery is telling us, what the CBTC scans are telling us, it seems to my amateur eye to be irrefutable that when the jaws are pulled back in the face, problems happen with the joints, airway gets smaller, and health consequences are going to occur. Now, I know as a doctor, you can't be that definitive and how you present that argument. But to me, as somebody who's been an observer for the last 25 years, the evidence is absolutely irrefutable. Why do you think orthodontists and the orthodontic profession is so resistant to see that for what it is and be on the front side of change instead of being dragged by the rest of you to change?
I think it's much easier. It's always have been done that way, and I'm just follow the footsteps. It's much easier to follow somebody else's footsteps, whatever they're right or wrong, than try to be against the current. That's just a very simple answer. The orthodontic students, orthodontic residents, they taught in a certain way by all the generations of orthodontists who had, great smiles, but they look like, just smile, like without rest of the body. Just like I mentioned before, we look from the face, whatever, from the neck up, or we just focus on this area, and on a typodontic look great, or on the models they look great, on the scan they look great, but if you connect them with the face, they have a big buccal corridors and then small airways and not toned airways. But I think for me, like, this is my view of somebody who had a training from two different worlds. When I moved to United States and I went to NYU, I was surprised with the amount of algorithms. Like, this is the way how we do it. It's very organized, structured. That's what we do. That's what we do. Like, and I retrain my brain to practice in the algorithm. And yes, it's much more organized. Instead of, in Russia, we were always thinkers, trying to get a solution outside of the box, scarcity of material and all of that. But, it's so much easier to just follow, the direction and just keep going that way. And that's why I think orthodontist community, great thinkers, but they just train in the algorithms, and they just follow, and they feel, they have a certain, I would call it axiomas, certain criteria, what's not changeable, and it's already set that way in the head. But I think it's changing. Last week, I had a wonderful dinner with my colleague, orthodontist, Dr. Inna Gellerman, and we discussed what now she works in a very close conjunction with ENT to check the airway before she starts treatment, and in a very close proximity with myofunctional therapist. She wants to develop tissues around the airway when she does her orthodontic treatment. So I would say, with your help, world is changing. Yes, it's not going to affect every single person in the same time, but I think this message slowly but surely going to get into the minds.
It's funny. I think there's an emotional journey that happens with doctors when they have to rethink how they've been doing things too. Barry Raphael is a friend of mine. I've known him for a long time and have a lot of respect for him. And I was there, I want to say it was 15 or 17 years ago, when he was at a course where he started to realize that what he'd been taught and what he had been doing for his entire career. And Barry was a highly successful and very well-respected orthodontist for a long time in your neck of the woods. And he realized that what he had been doing was not in the best interest of his patients, and also knew that he didn't know that while he was doing it. And he had a very profound emotional rearrangement during that weekend when I saw him. And I remember how much he struggled with accepting that what he had been taught was not what he thought it was, and that now he had to unlearn all of that, relearn something else, and recommit to doing things a different way. And that's a lot for somebody. And Barry was mid-career at that point. He was probably in his early 50s, I would guess. So he'd been practicing for 20 or 30 years. He had a lot of happy patients that loved their smiles, but he now carried the weight of knowing that what he had done was potentially causing problems for a lot of those patients, and certainly not setting them up for a healthy life the way he believed he always had been. And I think the emotional heavy lifting that goes along with that, and Barry's if you know Barry, he's a very introspective guy. He's a very self-aware guy. He's got a heart as big as his whole body. He wants good things for everybody. So I think he had the emotional IQ to be able to cross that bridge, for lack of a better way to put it. But I think a lot of these practitioners don't have that emotional IQ, and they just can't deal with the thought that what they've been taught to do and what they've been doing, perhaps even inadvertently and without them knowing, had hurt a lot of people, and they just dismiss it and keep doing it because they can't face the fact that maybe they aren't who they thought they were.
You're absolutely right. Every step requires a lot of courage. And Barry Raphael is, I highly respect him. He's my next door neighbor, actually. But, I have, he was on my channel as well, and I respect him from any point of view. But again, courage, making the steps forward and admit, it's a lot of, energy. That's a difficult step. I understand him. And I saw, I've witnessed his journey. I saw everything what he was doing, and I think it's great. And it changed, he gave a lot of courses to a lot of orthodontists, and he changed philosophies of a lot of people. And people like Barry, we admire them. We want to be like them.
I do.
Yeah.
Let's talk about courage. What have you seen, and what kind of courage does it take for the patients to accept that they're in a situation that they didn't know they were in, that actually could have life or death consequences for them, and to get on a journey where they turn their health around through whatever means is necessary? What kind of courage do you see the patients having to have?
There are the different type of patients. I would put them in two different categories. And patients who we educate about consequences of sleep apnea. And I think it's a life-changing, and it's not only me. Of course, I have a team, and my team, help me on everyday basis to accomplish that goal. People come to us with that bouquet. That's not the people who got referred to us for sleep apnea. No, we're talking about regular patients who come to us for dental care. They come for hygiene appointment, and we evaluate medical history. And now we're talking about courage. We read the medical history: high blood pressure, acid reflux, sinus infections or not, atrial fibrillation. And we see the damage on the teeth. We might see damage of acid reflux, or we might see the damage of the bruxism. And now we start the education. And this education doesn't take one appointment. Like, we measure the blood pressure, and it might be a little bit high, but people so set in a way, my health is okay, I'm not going to add anything else. And we recommend, maybe, how is your sleep? Does your wife complain on snoring, right? Does she sleep in a different bedroom, right? Yes, it's all of it true. It would be a great idea to refer you back to your to your primary care, and we would highly recommend for you to have a sleep study. So, they don't accept it. They don't take it. They don't want to get additional additional concerns. And it take time to develop that trust and re-educate them over and over and over again. But we see it as a mission.
And
And
what about the spouses? My heart breaks for the spouses, especially with us men, because we're so stubborn and we just want to get back to work and make money and provide for the family. And it doesn't, you can say to us as much as you want, well, you're no good to your family if you're dead. But when I hear that, I'm like, no, actually, that's the life insurance comes in if I'm dead. I gotta keep running because I've got to provide for my family. That's just kind of the wiring of, I'm being a little dramatic to make a point, but that's how we're wired. And I know a lot of spouses, and most of the time I've met, it's the wives who really get concerned about their husband's health, but can't get them to take action. What about the courage of the spouses and how they stick with it until they can finally find a solution? What's been your experience there?
My respect to the spouses, like my respect. And I always, we do have a lot of families in the practice. And if I see the situation, I can bring husband and wife together and educate them both, like to have a little conversation, not in the dental chair, but in my office. Why don't we have this conversation about different aspects? Maybe we can make it better. Maybe you be able to reunite in the bedroom. And a lot of people want to reunite in the bedroom. But a lot of people put the headphones or, put something to close the ears because they cannot convince, usually, yes, you're absolutely right. It happened with the males. It happened with the men, with the providers for the family. They would be like, no, I don't have time for that. And wives, we can, what can we do? But, I think, what I believe, I just mentioned before, I believe in the power of social media. I believe in the power of media in general. I think if we be able to spread the word around, if the information come from different sources, they visit Dr. Sokolina's office, they listen to Peter Beckwith podcast, Airway Chronicles, they read some books, maybe not even read the books, maybe read about the books. And okay, they put all of it together. And now on the primary, on the regular physical, they say, I do snore. And I hope that time primary care physician remember our conversation, said, maybe it's the time for sleep studies. Also, it's another thing. Every single patient in my practice get a Snore Lab downloaded in the phone. I highly believe in the power of wearables, in the modern technology, as well as the Snore Lab. I don't think, it has to be in a very snoring is not a joke. It's not a laughing matter. It has to be done in a little bit scientific way. And I said, why don't we do this experiment? Why don't we load this up? And you record yourself. And then you listen in the morning. And then if you're ready, then we connect you with a proper way to get a sleep study, through the primary care physician, because we're in New Jersey and New York, we have a certain limitations. So I do it in a long way. But if they say yes, then we can work on that. But again, to the spouses, if they approach me, I also recommend them the same thing. You download certain things on the Snore Lab. You try to educate your spouses through my videos. I hope it's gonna work. Not in an offensive way, we're all tired, and then if you didn't sleep from snoring, then you feel really aggravated. But in a nice way, we're going on a nice journey together. We're gonna be in the same room. Maybe before that, why don't we prepare for our vacation in a scientific way?
I love that. And what about courage for practitioners? I think one of the things that I've noticed is that the practitioners struggle with being able to be as forthright and as honest as you have, because you're really speaking to the core with the adults, the married adults for sure, of what a healthy relationship is made of. That intimacy when husband and wife are in the bedroom together, and it's not just sexual intimacy, it's physical intimacy, it's emotional intimacy. When that's taken away, the risks that they run of infidelity, separation, divorce. That's all real stuff. And we tend to paper over that and just kind of, sand the edges off of it. But that is where those things tend to lead when health goes downhill and men and women can't communicate openly about what they're struggling with. What advice would you have for other practitioners to start to wade into having conversations with more depth and weight than just, you're going to get high blood pressure if you keep snoring, which they will, but there are deeper issues there that affect the family structure, that affect the primary relationship, that ultimately affect the children. How do you help practitioners start to have those conversations so they can have a more meaningful impact on their patients' lives overall?
I believe what we as a dentist, we're in a very fortunate position, because we actually the practitioners who see the patients the most. I'm not talking about, let's talk about hygiene visit. Of course, yeah, you can start, hygienists, they have I would say, most intimate relationship. They see the patients the most. And if they educated enough by the practitioners, they can start the conversation, and then they can call the doctor in after they mention to the patient. So the practitioner can mention something as well. But we graduated from dental school with the name dentist, but we are medical providers. We are medical providers responsible for, for health of the patients, because, any part affect other part. We all connected, not like I like that. I always say headless horseman. It's not like that. We connected, head connected to the rest of the body. I think it's great when that's our mission. That's why we are in that field, to have impact on patient health, not always with the actions, but sometimes with education, and to start that conversation. We spend as well, in addition to we see patient often, if we do the big case, let's say not just one filling, but if we do the implants or periodontal treatment, we spend a lot of time with the patient, and during that time we have opportunity to create the trust, to create the connection, to find the words to bring the message. I think we're just in that very unique position. Patient is not under anesthesia, patient is fully awake. We can have conversation before the procedure and after the procedure. We are very fortunate as a providers, and who if not us?
Well, I think that's a question I've been asking people like you for 25 years. I think that's a great question. And I know for me, before I embraced treatment and the apnea was progressing, one of the things that I fought the hardest was depression. When I didn't sleep, the depression, and depression is it's interesting. It's kind of, it's sort of in vogue to talk about depression now. My experience with depression is it's very sneaky. I didn't really understand that, I've got a mental health thing going on. I was tired. I wasn't open to possibilities. I started to become convinced that this is how my life was going to be and it couldn't get any better. And it was very subtle and very slow. And to your point about having that intimate contact with clients, or with patients, I think that hygienists and dentists, with the amount of time that you spend with patients who are suffering from, I don't know anybody that's got untreated sleep apnea that does not have some level of depression. And I talk to patients a lot, and they all are down to one degree or another, because without sleep, we can't physically get to a state of hope on a consistent basis. It's not possible. And to be able to have those conversations, I believe, does take some courage on the part of the practitioners and the entire team. How do you keep your team excited about having those difficult conversations and continuing to plant that seed to when the patient is ready, they'll hopefully embrace some treatment?
I'm going to mention about 2 points from your speech. Number one, with depression, when I mentioned the bouquet what patients bring to us, depression and anxiety, that's part of the bouquet. I just didn't want to mention that. That's usually depression and anxiety, and then we look at the list of medication and we see that. Yes, and of course you cannot not be depressed if you don't sleep well, if your REM is affected, and in addition to that, if you have we don't talk about sexual issues, but if you have a problem in that department, that's going to make you depressed. If your sleep is constantly interrupted, that's going to make you depressed. If you're suffering from all other things, that's going to make you depressed. So that's very it's not even a question how, how a patient get depressed and it's very hard to take action if you depressed. And I call it the circle. That's our mission, to break that circle, with providing them a good sleep. And to make my staff excited, I think they see on everyday basis the difference what they make into the patient's life. Because it's not, they see me on the screen, on the phones when I do my little, my little talk, but more of it, they see people in the office who come to the office so grumpy and sad and tired and waking up and complaining on, snoring and this and that, and they leave in the office with the hope. They feel much more energetic, and they say, like, you asked me about tragic case, but I'm going to tell you about good case. I don't want to talk about tragic case. I don't want to talk about bad things. I want to talk about good things. But they come, with the treatment we provide, and they said, you know what? I wake up today at 5 and I start washing my floors. I really notice my house is so messy. Like, over the years, it would be for females, I didn't even notice that's total mess, because she was so tired, but this mess, she didn't see that mess. And then she wake up at 5 and she feel, okay, I slept enough. And now that's my time when I can clean or do whatever I want. Or, same thing with the driving. A lot of people are scared because they fall asleep behind the wheel. And they don't take trips, they don't do anything exciting, which make them depressed as well. And then they say, and then we drove to the shore, and I was, I was okay and I was happy. But like, to see, like, you don't have to look for something so heroic. Oh my God, I did something so heroic. No, those little things, little difference, what, you change the whole mood. You put the light into that life. That's what we're here for. And that's, again, to keep staff excited. It's harder without that area of medicine what we practice. With the dentistry, I find it's a little bit more difficult, but that's like a final accord, final symphony, to make them excited and keep moving forward, because they actually see what they do.
Yeah. And I don't know if I'm going to include this in the final version, but you talked about, we don't talk about sexual issues. It's such a big part of depression and not sleeping. And we need to talk about it, especially with
I agree
couples.
with that 100%. They come to me, they share that. It seems like, I don't know how open you are, like, I'm new to you, you're new to me, but people come to me and they said, I'm so sad about that. And it's like, it's embarrassing to bring up, but it's nothing embarrassing because it's a normal physiologic reaction. They get it because of that.
I think to the depression issue too, I think that can contribute to the depression of the spouses, because we associate in a marriage sexual activity with attractiveness. So it's one more layer. When that doesn't happen, I'm going to personalize that, she doesn't love me anymore, or she doesn't find me attractive. No, she's just tired. And I think when we get to a point where we can start to, and obviously in a safe and appropriate way, but start to incorporate the entirety of the psychological and spiritual experience of being with somebody who suffers from sleep apnea or suffering ourselves, it really does affect every area of life. Parenting, where we don't have the energy to interact with the young ones, or I have a 17-year-old who's still at home, asking her how her day is and really being engaged in the answer to that question, so I can connect with her in a way that lets her know that I really am interested in the response that she's giving me. It goes on and on and on. And I think to the extent that we have the emotional and verbal skills to engage in those conversations with patients one-on-one in the room in an appropriate and safe way, we give them that much more of a chance to embrace treatment so that they can get better and embrace that hope that you're talking about. So I appreciate